Osteomalacia. Osteomalacia describes the decrease in mineralization of bones in adults due to the various causes, one of which include the lack of vitamin D. This disease occurs in adults, weakening their bones, causing them to break down quicker than they can reform. The normal anatomy of the bone. The bone consists of two types, spongy bone and compact bone. In spongy bone there is a substance called lamelle, which forms rods and plates called trabeculae. It contains osteocytes and consists of bone marrow. It is lighter than compact bone and supports the end of long bones to compress when pressure is applied on the bone, and it forms the inner layer of all bones. Compact bone, however, provides protection and strength. It contains osteocytes as well, and has central canal, contains nerves and blood vessels. The structure is parallel and thus can resist the stress in specific direction. Bone consists of two sections, the epiphysis, which is a spongy cancellous bone covered by a thin layer of compact bone, and a diaphysis, which is a tubular shaft that runs between the proximal and distal ends of the bone. Bone cells are called osteocytes and are structured in a matrix-like form which contain calcium and phosphate and accounts for 2/3 of the weight of the bone. The bones also consist of collagen fibers, which account for 1/3 of the bone's weight. The contrast between disease state and healthy state. In a healthy state, when remodeling, osteoblasts pack down osteoid, which is a matrix and guide to mature over 2 weeks with the help of several enzymes. Once matured, the mineralization involving calcium phosphate begins. The calcium phosphate is layered inside the bone surface and then converted into hydroxyapatite. This molecule is then uptaken and transported to matrix vessels, where more phosphate is available. The Harversian canal is made up by lamelle and trabecular bone tissue, consisted of hard and soft tissue, which are constantly being remodeled and reformed. As you can see here, in a normal bone, the pores are less small and are more compact, whereas in an individual who's suffering from rickets or osteomalacia, their bone has bigger pores, and thus the bone is more fragile and easier to break. The contrast between the disease state and the healthy state. So the disease state, there is a negative effect on mineralization of the outer shell of the bone called the cortex, where there is a lack of phosphate and calcium deposits due to the low levels of vitamin D. The bone becomes soft and weak. If vitamin D levels are low, the body cannot uptake calcium and phosphate from food and thus leads to demineralization of the bones. In osteomalacia, the mineralization is ineffective as the osteoid matrix is laid out incorrectly and thus makes the bone less rigid and instead soft. So which populations are at particular risk and what is the incidence in Australia? The incidence of osteomalacia in Australia is approximately 1 in 1,000 people. Individuals who are more prone to suffer from osteomalacia are individuals who do not get enough exposure of sunlight, such as elderly who are unable to go outside or are homebound, and women who choose to cover up due to religious reasons such as wearing a burqa. Dark-skinned individuals, as darker skin pigmentation has lower capabilities of processing vitamin D from the sun. Individuals who are not receiving enough vitamin D through diet, example lactose intolerant individuals. Individuals who are suffering from a renal or hepatic disease. Patients taking medicine which might inhibit the uptake of vitamin D, and an increased age as the skin's ability to make vitamin D decreases with age. How is osteomalacia currently treated, managed, or prevented? Treating osteomalacia as a result of low vitamin D can be resolved with ensuring adequate dietary intake of foods high in vitamin, calcium, and phosphate, as well as regular exposure to sunlight. Vitamin D supplements can also be taken if necessary. Osteomalacia caused by tumors can be treated by surgery. Through surgery, the tumor can be removed. However, ineffective removal can result in the tumor reoccurring. In cases where the tumor cannot be localized, daily supplements of phosphate and vitamin D are sufficient. Osteomalacia can also be treated with ultraviolet irradiation if caused by malnourishment of vitamin D. Thank you for listening to the presentation.